Thanks for staying with us. The Nigerian government's proactive effort towards universal health coverage and immunization have garnered commendation from the Vaccine Network for Disease Control, Vndc, and collaborating public health organizations. The commendation was given during a media dialogue themed Nigeria's immunization financing for vaccines and devices navigating financial challenges with resolve, which held in Abuja. Founder of Vndc, Mrs. Chika Ofo, lauded the federal government's proactive stance, however expressed concern over the delayed release of substantial funds from the allocated immunization budget for 2023.
If these funds are not released by the 31st of December 2023, the funds will expire and cannot be used subsequently for procurement of vaccines and devices. B. There's a possibility of shortage of vaccines in Nigeria, leading to the resurgence of vaccine-preventable diseases, God forbid. This is a serious blow to President Bola Ahmed Tinubu's renewed hope agenda. Introduction of new vaccines. The approval of the malaria vaccine for 2024 is a commendable stride by this present government, but it cannot be achieved if there's no money. Call to action. We urgently advocate to the Accountant General of the Federation for a swift release of the cash-planned 60 billion immunization fund. The timely release of this fund is paramount to sustaining the momentum in our country's immunization effort.
Representing the Africa Health Budget Network, Mrs. Oyeyemi Peter stressed the significance of vaccination in increasing life expectancy, saying with Nigeria having a high number of zero-dose for children, it is necessary to make vaccines readily available to control infectious diseases.
And so we cannot afford stockouts. We cannot afford the fact that there's no vaccine, there's no program. They are hard to reach areas. There are people that are difficult to reach them. So these fundings are actually fundings that they are using for all of these programs. So that means there will be no money for programs to reach people, the communities, people in hard to reach areas that they can have immunization. And you know the implication of that. Death, there's polio. We've been able to overcome polio over the time, right? And so, if there are no vaccination, then there's going to be. If there's no vaccination, then all of these outbreaks will actually come back. We don't want to experience that.
The groups jointly emphasized the need to secure the future and ensure financial stability for public health as the nation grapples with challenges related to immunization funding.